Okay, we are going to go ahead and get started. But welcome to this is our third annual Forge Health Pride panel. So every month during Pride Month for the past 3 years, we've been hosting Pride panels. I am really excited about today's Pride panel where we will be focused on LGBTQ plus and young adults navigating mental health and identity. Before we jump into our discussion for today, just a few things. If you don't know about Forge Health, I'm just going to spend a couple of moments talking to you about what we do and who we are. Forge Health is a mental health, behavioral health, substance abuse provider that provides care to individuals with certain specialty areas that we focus on. LGBTQ plus is one of the focus areas in which we have specialty in. Some of our other focus areas it consists of veterans and first responders, as well as psycho-oncology services. We offer outpatient services, telehealth services, medication management, including medication-assisted treatment, as well as intensive outpatient services. Our services are in 4 states: New Jersey, New York, Pennsylvania, and New Hampshire. We have clinic-based services as well as telehealth services. We try to meet the clients where they are. So we don't force people to come into the clinic, and you can receive all services via telehealth if you need it and or inside of the clinic. We also pride ourselves in being able to integrate seamlessly into primary care physician offices, healthcare systems, and so forth. We like to see ourselves as an innovative partner within the behavioral health space. And so, if you're ever looking for thought leadership, partnership, advocacy, because we are not afraid to advocate for the underserved population, we are here to support the community wherever they are needed. So, that is a little bit about Forge Health. Now, who am I? I am Dr. Cleo Booker. I am the Chief Clinical Officer that leads the Fourth Health Clinical Team. It is my honor and privilege to be able to lead that clinical team that is filled with subject matter experts that are also as passionate and as seen as an advocate in the community as well. So I see a bunch of my Forge Health clinicians out there. Hey, y'all. So happy to have you join this conversation. Now, just a little bit of housekeeping. If you want any kind of answers asked or requested, there is a Q&A section within the Zoom that you're able to click on and ask your questions. At the end of this panel discussion, we will have a few minutes to kind of go over any questions that are asked. So please do not be afraid to go ahead and put those questions in there as we are chatting. I will be facilitating some conversation in the beginning, but we do typically leave about 15 to 20 minutes at the end for any public comments or questions. I just ask that you please keep yourself on mute throughout the entire portion of this panel discussion today. If we find you unmuted, there will be someone in the background, Christina, who is helping me kind of manage our Zoom platform today, that will most likely mute you as well. Additionally, she will be helping me to look at any of the questions. But if you could please keep yourself muted through the entirety of the panel conversation, that would be really helpful. Additionally, this is a free CEU event. And so you will be receiving a CEU after this, and it's only for live attendance. We are recording the event, so just to let you know, and it will be available on YouTube as well. So, done with housekeeping items. Now, I have the pleasure and honor of being able to moderate and talk about today's conversation around LGBTQ plus young adults navigating the mental health system and their identity. This month, we hold the space for Pride Month and Juneteenth, which are two celebrations that are rooted in liberation, resistance, and resilience. These movements together, Black liberation and LGBTQ plus rights, have a long history of collective action. And history has shown us that our healing and progress are interconnected. Today's conversation will focus on mental health of LGBTQ plus young adults through the lens of intersectionality, equity, and action. Our panelists today consist of Dr. Ralph Bernardo, who currently is the medical director of LGBTQ plus services at Valley Medical Group. Dr. Bernardo further specializes in infectious disease, as well as he's had training and a specialty in HIV. His primary clinical interests encompass the comprehensive treatment and prevention of HIV, viral hepatitis, and sexually transmitted infections. Driven by his compassion for the health of the LGBTQ plus community and leveraging his extensive clinical expertise, Dr. Minaldo has spearheaded various developments across the New Jersey area. He currently serves as the medical director at that center. Thank you, Dr. Bernardo, for joining us today. Our
Happy to
other
be here.
panelist is Kara. Kara, Assistant Director of Behavioral Health for Forge Edge, New Jersey, is a licensed clinical social worker and serves as an Assistant Director of Behavioral Health for Edge. She earned her bachelor's in public health and her MSW from Rutgers University. I see some Rutgers people out there, so shout out to Rutgers, with over a decade of experience in nonprofit sector. She is passionate about her role in driving the community towards improving efficacy for services and improving positive health outcomes. She is committed to advancing equity for the LGBTQIA plus individuals and those living with HIV who often face disproportionate mental health and substance use challenges. Thank you, Kara, for joining our discussion today. Brian. Brian, welcome as well. Brian serves as the Director of Clinical Services for Attic Youth Center. He also has a private practice. He earned his Master's of Education in Counseling Psychology from Temple University and has been practicing in the field for over a decade. He specializes in working with LGBTQ plus youth and families and BIPOC community. Brian's primary areas of clinical focus are supporting clients through gender identity exploration, racial identity formation, grief and loss, as well as facilitating family, couples, and group therapy. He is really passionate and is an advocate for social justice, inclusivity, and all of these values have fueled his work in the community. Welcome, Brian, and thank you so much for joining us. All right, panelists, y'all ready to dive into this conversation? All right, let's go. My first question, just kind of deep digging into it, not pitting around. I'm going to throw the question at you, Brian. How does race, class, and other identities shape the mental health journey for LGBTQ plus young adults? What are your thoughts around this in today's environment?
Yeah, thank you for the question, Cleo. What I really appreciate about this question is the focus on intersectionality. And when we think about intersectionality, I hold that really important to the work that I do. For anyone that's unfamiliar, it was termed by Kimberly Crenshaw in 1989, essentially focusing on the ways in which our different identities connect to create a unique lived experience for each of us. And I think that's especially true when we're focusing on constructs such as race and class and connecting that to an LGBTQ plus identity. Um, Something I see in the center, working at Attic Youth Center, working with primarily BIPOC youth, is there can be a mistrust of the system, um, focusing on a racial connection there. And that connects to a really complicated history that BIPOC people have with healthcare. And I think it's important for all of us to really keep that in mind when we're working with these communities, that the mistrust isn't personal, like it comes from decades and generations of harm that's been done. It can be protective as well. Um, so that speaks to some of the importance in taking a holistic view when working with marginalized identities. Literature suggests that our racial minority clients not only have higher ACE scores, they also have a less likelihood of connecting to services. So that puts a focus on us as providers and seeing how do we be intentional about that relationship building? How do we reduce the barrier to treatment as well? And then considering class as well. Oftentimes, if we're viewing it from like a hierarchical lens, if someone doesn't have their base level needs met, like thinking Maslow's hierarchy of needs, there's food insecurity, there's housing insecurity. Someone's not going to be in a space where every week they're going to therapy or they might not have the financial resources for that. Um, so again, the onus falls on us as providers in seeing how do we combat that. Combination of ways. It's assessing the need. It's again viewing that holistic lens when we're working with people, and not just like the problem or the symptom. Being mindful if someone is missing a lot of appointments, asking about what's going on, asking, is it like a housing thing? Is it like a change of appointment time? And again, the focus on how do we really be intentional about relationship building, because that trust is earned. It's not just something you get just through your credentials or the letters after your name. So that's a little bit about what I'm thinking there.
Thank you, Brian. And I love the fact that you brought up ACEs and how this population often has a higher ACEs score. I'm not sure everyone on the call understands like what ACEs is and what does that mean. Ralph, would you like to expand on that a little bit? It kind of leads me to another question around what are the common things that we see in mental health of LGBTQ plus population. And ACEs was a really good point that you brought up, Brian.
Absolutely. We could definitely explore the mental health challenges a little bit further here, and I think it's a great time to do that. So I'll tell you, in my clinical practice, and I think we consistently see this supported by the data, LGBTQ plus youth, they navigate a landscape of mental health challenges that are more pronounced and complex than those that are faced by their heterosexual and cisgender peers. And I think the social contexts that they exist in, I think significantly impact their well-being as well. One of the most pervasive challenges we observe is the heightened prevalence of depression and anxiety within the community. And for instance, national data from organizations like the Trevor Project, for example, that consistently show that LGBTQ plus youth report significantly higher rates of persistent sadness, hopelessness, and symptoms of generalized anxiety. And this isn't an inherent vulnerability. I think it's more of a direct response that we see to the chronic stress of minority status. And I think this includes experiences of prejudice, discrimination, the constant fear of rejection, for example. And this can manifest as things such as social anxiety, chronic worry, or even a pervasive sense of isolation, even when surrounded by others. Even more so, we see that the rates of suicidal ideation and attempts remain higher within this population as well, and that they remain a critical public health crisis, I think. The Trevor Project's 2024 National Survey on Mental Health of LGBTQ plus young people, for example, I think the number was somewhere around 40% of LGBTQ plus youth seriously considered suicide in the past year. I mean, that number is astounding.
Yeah.
It's frightening. And I think this number was nearly doubled for transgender and gender diverse youth, closer to 50% of them, of those individuals reporting serious suicidal ideation. I mean, one in two. And I think this disproportionate burden is often linked to experiences surrounding things like, for example, family rejection, school bullying, which unfortunately is still very pervasive and now extends to things like social media, now that we're in the digital age, and a broader societal invalidation of an individual's identity. And the cumulative impact of these stressors obviously can be devastating, which I think these numbers sort of highlight. Beyond these widespread issues, we also see frequently trauma-related disorders, things like post-traumatic stress disorder or PTSD, which often stems from repeated experiences of victimization, harassment, or believe it or not, even physical harm due to one's sexual orientation or gender identity. And it's this kind of chronic identity-based trauma that can deeply impact a young person's sense of safety, their sense of self-worth, and their ability to form healthy relationships. And these are things that I think the rest of the population takes for granted, and that we need to focus on more when we care for the LGBTQ plus community. And finally, I think some LGBTQ plus youth also turn more to substance use disorders as a coping mechanism. For example, managing stress, anxiety, or even the pain of rejection. For example, we know the rates of tobacco use are higher within the community compared to the rest of the population. And while the experiences are not necessarily diffuse across LGBTQ plus youth, I think the increased risk factors are undeniable within the community. And these interconnected issues highlight, I think, the need for urgent, comprehensive, affirming, and easily accessible mental health services that are not only available, but I think that are designed specifically to meet these unique needs that the community faces.
Thank you, Ralph. That was such a comprehensive response with so many facts in it, as well. And one thing that stands out to me that it just so happens today, and you brought up the Trevor Project and the fact that 40% of this population actually thought about committing suicide. And Ralph, one thing that you also mentioned was these programs have to be designed for the population. And the Trevor Project actually did design a crisis line to support LGBTQ plus population, via their crisis supports. And unfortunately, it was announced today that that funding was cut for the Trevor Project. Um, and when things like that happen, I'm quite sure it shakes up the community. And all of you have talked about the trust and mistrust that this population, especially young adults that are just now coming out, they've also been rejected and bullied, but there's also policy and procedures and actions in society that leads them to believe not to trust the system. Kara, I'm kind of wondering a little bit about like your thoughts around how do we build up trust in this community to reach out for help when things like this at a national level is happening?
Yeah, I think that's so important. And especially as Brian and Ralph both referenced, right, that there's real systemic issues here, right? And there's real systemic discrimination that happens, and particularly for those individuals who are, dealing with intersecting identities that increase the amount of minority stress and traumatic stress that they experience, and particularly in healthcare settings. Um, I think number one, we need to validate that. We really need to validate people's responses to those stressors, and validate that their experiences are not personal weaknesses, but they are systemic problems, and they're normal reactions to systemic issues and to discriminatory treatment. So that would be number one, validate and normalize their experience. And then number two, I think, being honest and open and authentic, right? Showing up as, somebody who genuinely cares is important. I think a lot of people who have had negative experiences in the healthcare system have a pretty good sense, right? They have that kind of like intuition when they're dealing with somebody who is in a position where they're supposed to be caring for that person and they're not really being authentic. They're not being genuine. Maybe there's judgment that's coming through. That may or may not be intentional, but it's still happening, right? And so as providers, we really need to be owning that, and openly talking about, the power dynamics that are happening even in the relationship, right? In the therapeutic relationship with our clients. Um, and then also acknowledge what you're doing to change that, right? Acknowledge what you're doing to work on that and make sure that this is an experience that hopefully will feel a lot safer and that will encourage people to stay engaged in their healthcare, whether that's mental health care, physical health care, it's all related. Um, right. And also again, like making sure that we're deconstructing this idea that, that there's a personal deficit, right, in people's hesitancy to get care when they've experienced trauma in relation to their healthcare before, and really deconstructing that kind of like medical model of things, right? If you have symptoms of trauma, right, that doesn't necessarily mean that you did something to deserve that, right? Things happened in your life and you're having a normal experience, a normal response to an experience that should not have happened.
Thank you, Kara. I often tell clinicians here at Forge, we recently did a certification on gender affirming letters of support. So I have a cohort of clinicians that went through that certification with me. And one of the things that I basically emphasized over and over again is to validate and to support. So, Kara, thank you for saying that, because when we have young adults in our presence that are going through these processes and changes and trying to understand and advocate for themselves, they are the experts. Usually, by the time they reach a mental health professional, they have tried to talk to someone, they have done their own research. They pretty much understand, like, the path that they want to seek. And so, we have to see them as the expert that teaches us. And so that's what I try to kind of reinforce as well. And I know Brian and Ralph, you both also see clients as well. So I'm curious on what are some techniques that you use with this population when they are in front of you, and especially when they are having a trauma response. As Ralph indicated earlier in the conversation too, the best way to provide support for this community is to create specific interventions for them. So I'm just curious on, like, what do those interventions actually look like from your perspective? Ralph or Bryant?
I can go and then, yeah. So for me and my practice, it's kind of falls into a few different categories for me. We've kind of learned throughout like our formal education, grad school, the importance of the clinical relationship. So, kind of emphasizing from what Kara's been saying, being really mindful on that rapport building, being really intentional about fostering that connection to have trust. And when you do that, I'm connecting that to some tangible skills as well. Especially when like someone might be having like different trauma responses coming up or there's uncertainty around it. There's a lot of value in just like connecting to a tangible grounding exercise, for example. And not only just like giving that to the client, but also like practicing it with them in session, because that it creates an opportunity to give feedback and what's working, what's not working, and kind of go to the drawing board together if you need it. Um, and then again, taking it back, I sound like a broken record with this, but really meeting the intersectional needs. It's so important because there's no one size fit all approach to working with anyone. Um, I consider my own identities like I am Black, queer, first generation therapist. It shapes my values, it shapes the people in which I connect with, it shapes my fears as well. And the same is true for our clients. So really being mindful of who they are holistically again, and determining like what area needs what. And you mentioned earlier, Cleo, the client as being the expert. I so agree with that. It doesn't come from us just being like, do this, do that. Like it's a collaboration, and that engenders more independence and autonomy in our clients.
Of that, thank you.
I agree. I echo everything Brian mentioned. I think a few things that I will add is, or echo even further, is the need for validation. And I think that that's something that patients are looking for that they're not getting outside. And so that sense of validation, that empathy piece, I think, can speak volumes for patients. The other thing is signs of solidarity, creating a safe space, right? So what we say and do is one thing, but the clinical space I think is important as well. You want a space that is comfortable, affirming for patients, a place where they feel comfortable sharing this part of their lives with you. And so, for example, in our office, we have pride flags scattered throughout the office. We have art hanging in my exam rooms in particular, where I see patients. We have staff wearing pronoun badges. I typically will wear another small sign of solidarity, for example, pride bracelet or a pin on whatever I'm wearing, my white coat, shirt, for example. I think signs of solidarity are also important as well to, again, in a nonverbal way, say to the patient or signal to your patients, we're here for you. This is a safe space.
Yes, I love that. It is important to make sure that our clients feel comfortable in their spaces because oftentimes they do come in with that hesitancy if they're going to be seen for who they really are, or are they going to be convinced to be something different. So that whole, non-evidence-based treatment of conversion therapy sort of thing. I think clients are still kind of scared that when they walk into a therapist's office, they're going to try to be converted to something they are not. So putting up those kind of like you said, non-verbal visuals is important, especially when trying to help individuals feel safe indeed. Kara, I know that with your work with Edge New Jersey, and historically with your work with nonprofit organizations, there are a lot of community-led efforts that you've been a part of. And it just so happens that we're having this conversation right before Juneteenth, but I think it is perfect and fitting. So I'm curious on if you can expand around the importance of, marginalized communities such as the Black community as well as the LGBTQ plus population coming together to make change happen. How have you seen that occur? And what would be your advice to get, the communities together to do things like that more often?
Yeah, so as you mentioned at the start, the Black community and the LGBTQ community do have a long history, a long shared history. And really, if we're looking back like all the way to the 1960s, right, the early queer advocates and activists, right, built their platforms based on the work of the civil rights movement, right? They copied really a lot of the strategies that were being used and that were effective in order to, gain some rights for the LGBTQ community as well. And of course, as we know, there's a lot of overlap, right? There's people with those shared identities, um, and so, those of us in the queer community were really, our rights are really built upon the foundation that was laid by Black leaders in the civil rights movement, and even earlier than that, So we really owe a lot to the Black community, and we need that partnership, right? There's power in numbers, and the more that we can band together and look at the things that we have in common, and the rights that we all need as human beings, the more power we have to affect change, within our communities, on the ground floor, right, and then also systemically in the government.
Thank you, Kara. And Brian, I also know that this is a passion of yours, being a part of the community as well as the Black community, both populations that we're kind of talking about right now. And I am just imagining and saying this out loud that oftentimes people expect you to lead the change in these areas because you are comfortable in your skin and people know that you are, part of both communities. But I bet that can be tiring when people just expect you to lead the change. So, what would be your advice of people that are looking to like get involved and advocate and be an ally of marginalized communities or specifically the LGBTQ population and community and young adults?
Yeah, thank you for that point because it can get tiring. Um, but yeah, it really, to some of what Kara's been saying, it falls on all of us. It's not, there's harm when we think, even with the best intentions, like, we're trying to advocate for this community. So let's tokenize someone, let's put them on the stand and let's have them do all that labor. Um, Everyone has a responsibility to work towards liberation. Because I truly believe that, there's no liberation unless we're all free. We see right now a lot of othering that's happening in the queer community, also historically in the Black community as well. There can be feelings around queer identities in the Black community and like it being justified through religion or whatever the thing is. And right now, there's like, as our trans siblings are having more of a spotlight, that's also unfortunately come with more of an attack as well. Outside of the community and unfortunately within the community too. We're hearing things like, I just want LGB and no T, and it doesn't exist unless we are all committed to the mission. So when I think, someone having the goal of wanting to work towards like liberation or education, it starts by just being informed, doing some of that labor on yourself and not pushing it off to someone else because it's your problem as well, even if you're not on the chopping block right now. It, as soon as that a group or population they receive harm and they're moved away, you're the next person. So just keeping that in mind. So doing your own labor, also being intentional around like what your community looks like. I've worked in a lot of different populations, and I find like sometimes when I work in like my higher SES populations, it's easier for people to just be like, well, I don't see those people, I don't know. It falls on you to create those connections and be open to going to a pride event, be open to learning more about an organization. Also, it also boils down to like finances too, like donating to causes that are meaningful because it's going to impact the community as a whole too. So there's many different ways in which it sounds cliche, but we can all be the change, I guess.
That's actually a hashtag that I use, be the change. So if it's cliche, I love it. I love the cliche, be the change. But yeah, you're right. You can't wait for the change to come to you because oftentimes when it's in your face, it's too late. I love the fact that you said that, a lot of people, it's easy for them to ignore because they're not on the chopping block yet. But next thing you know, it is in your face and you can't ignore it and you're looking for help. So historically, it has been marginalized communities that stay supportive of each other throughout the entire year, no matter who's chopping block, who is up, So that's also too kind of being triggered, as you said that, Brian. So thank you. But I do agree that you have to be intentional with learning, be intentional with becoming involved, donating your effort and time. And one thing that you said is, inform yourself. You may not know everything. None of us on this panel know everything or completely can explain everything or feel comfortable in all spaces. But the fact is, we're using our voice to inform others and learn from each other. And that's what has to continue to happen, not just during Pride Month, but throughout the entire year, always. So just thank you, Brian, for kicking that point off. Um, as we kind of have 5 minutes left approximately before we open it up for questions from our audience, I want to make sure that we have plenty of time for that. I'm curious about, if you could change one thing today, each of you on the panel, if you could change one thing today to make the world a safer and more supportive place for LGBTQ plus youth, what would it be?
We only get one thing.
One thing.
Well, I guess I can kick it off. Just given the work that I do, I think one thing that would definitely make the world a better, safer place for LGBTQ plus youth would be easier access to comprehensive, affirming healthcare.
Mm.
Um, I think many people take access to healthcare for granted. And I think we need to make that access just as easy for anybody else, including LGBTQ plus youth.
Thank you.
I agree. And I would expand on that to say, I think access to good information is really important. Information that's accurate and true and realistic. I think there's a lot of misinformation and disinformation out there about the community and about some of these concepts that are really, really harmful to youth to hear. Things about you know. Uh, Trans people using bathrooms that align with their gender identity is somehow putting people at risk. Hearing those things can be really harmful to somebody who's young and impressionable and trying to figure out their identity, and then hearing these messages that they then can internalize. It can cause a lot of other issues for them. So I would say, as much true and accurate information as we can get out there, that would be, I think, one of the best things for youth.
Thank you, Kara.
Yeah. I think I was originally thinking access as well, and I'm going to segue a little to another thing that comes to mind that there's a need for is just more opportunities for socio-political engagement, more opportunities for our queer youth to be in positions of power, also opportunities to just learn more about the system that they're a part of, that we're all a part of. That knowledge, studies indicate it can really like break cycles and, increase autonomy, increase like self-worth as well. So it's something we do at our center. We have like a community advisory board that's like youth run. And they're involved in like making some of the decisions in the agency. And it's a great opportunity just to see what it looks like to like have a board, like they come to some board meetings, they vote on like different things structure wise in the agency as well. And it's kind of setting the building blocks to useful like life skills and responsibility just that they'll need later in their life. So just more opportunities like that. Like I said, that.
Building up confidence. Yeah, I love it. Hmm. Awesome. Well, I thank each of you for entertaining my questions thus far. It has been such a great conversation, and I cannot believe that we are almost 40 minutes into this conversation. So I am going to switch and make sure that we can answer some questions that are coming in from the audience. And one question goes back to the Trevor Project, and any of you can answer this, but it says, with the elimination of the Trevor Project suicide hotline, how do you think it will impact the behavioral health and clients within the LGBTQ plus community? How can professionals prepare their clients for the elimination of federal support?
I'll jump in. I think number one, this puts people at risk, right? This puts our youth at risk of at further risk of suicide. As Ralph said before, there's already increased risk for LGBTQ plus youth. And I think without having that layer of support there, this really puts people more at risk. So that's number one. And then how can we support them? I think we need to be getting really creative about what we can do within our communities, right, on the smaller scale, maybe, right, to make sure that there's a level of support outside of, one weekly therapy session, for example, right? What other local resources can we utilize, right? And what internal resources can we utilize to try to make up for that? But I think ultimately, it's really hard, right, to lose something that was so extensive and such a needed support in the community. So I think we need to do our best to fill those gaps as much as we possibly can.
Thanks, Kara. I think they had served close to like 1.3 million individuals since 2022 is what I recall. So you saying like coming together as a community to figure out how to do that gap, I think when you think about that huge population, that is the only way that we are going to help individuals at this point when it's been eliminated. So I think you're right in regards to being innovative and how do we prepare our teams to be able to support that outside of the one-on-one individual therapy will be key as well. A lot of times practices, health systems, they are afraid to tap into this space because they say they don't have the expertise. So I'm curious, once again, this is a question that's coming from our chat. how do you help, build a broader community and provide training to, health facilities or practices that see themselves as maybe able to help, but they don't really, they're hesitant because they say they don't have the expertise and they don't understand the population.
I think it comes back to just being intentional around like what training you're looking for. Like being mindful of the specific needs of your population and seeking out um, like maybe people to come to your center or agency to like do maybe an intensive all day. And recognizing that, you mentioned earlier, Cleo, you're still not going to be like knowing everything 100%, and that's okay. You can add to it. You can seek feedback and guidance from your community. Again, it falls on all of us to like do that work and connect with each other with where we can.
One of the other things I'll add as well is to really access things that are available locally, things like this, for example, right? This panel discussion that we're having today, I think there needs to be more of this in the community, but really taking advantage when these opportunities do come up to really find areas you think that you and your group can really benefit from, and getting involved and linking to these sorts of resources. And I think the other thing we need to do as a community is really work. Not that we don't already, but really leveraging collegiality and working together, right? So where are areas that perhaps one group shines with, and then another perhaps is lacking, and really leveraging our strengths so that together as a community we can really provide comprehensive services to the community at large. And I think we need to do that now more than ever as we see funding getting slashed from various resources across the country.
And do you all see this as an effort that clinicians and providers will be helping to lead the way on? So one of the questions is about how do we not just leverage our clinical expertise, but how do we become a part of that broader community conversation?
I think, as Brian spoke to before, right? Like getting involved, right? Like, really being involved in your community, go to queer spaces, right? That where
Mhm.
you're welcome, of course. To make sure that, you're understanding the needs of the community, right? I think a lot of people have a really good intention when they want to help, but they don't necessarily know what the needs are, right? And so really being involved in the community, right? And being getting, putting yourself, for example, like here at Edge, we make it a point to sit on different committees within our local communities, right? To make sure that, we are amplifying queer voices, right? And we're amplifying what it is that our community needs. So that way the resources that are out there and the people that do intend to help know
Mhm.
what we need, right? So I think doing that, even getting involved in like different consultation groups, supervision groups, right? Like we can, better educate ourselves and really understand more about what the needs of the community actually are, and that of course prepares you better to actually address those needs.
Mhm. Yes, yeah. Thank you, Kara. And I agree that getting involved and using the voices to advocate is important. What's interesting about being a clinician too is we operate in life from the lens of what we hear in sessions, right? Yeah, we throw it out the window when we leave work, but at the same time, it does stay with us to some degree, right? Like we hear the struggles and we hear the panic and we hear the excitement when they are allowed to be themselves and comfortable. And so because we are so in tune and that's what we do, oftentimes the community doesn't have the lens that we have or the insights because we're hearing those stories firsthand. So I agree. Like I advocate and encourage clinicians to become a part of the community and use some of those insights that you have to kind of push policy and push change because you have a special a special knowledge base that the majority of the population doesn't have. Not even most primary care physicians or medical doctors have the insights that you have because of the space that we create. So you can use that insight and that voice that you hear when you leave work, even though you're trying to forget it. But we don't forget human touch and relationship. It stays with us. So just use that in a positive light to push change. Another question we have is what would be 1 to 2 key things that an employer can do to provide a safe and inclusive environment for employees?
So I can kick that off. I think we sort of alluded to some of this earlier. I think the biggest thing is visibility, signs of solidarity, and I think if you make that a key part of your culture at work, I think that already is steps ahead. And so this includes things like, for example, wearing pronoun badges or wearing a pin, something that says, you're safe here with me. It's these nonverbal cues that I think really start to create that culture, that environment of safety, culture of creating an environment where people feel safe to exist. Um, and I will tell you that, occasionally there's pushback. People will say, well, I know who I am. Why do I need to be sharing my pronouns? And I often will remind people this isn't about you, right? This is about you telling other people that it's okay to be around, that this is a safe space, that this is a safe environment. So don't do it for you, do it for the community. And if you feel
Mhm.
comfortable with who you are, your gender, your sexual orientation, that's great. But there's so many people around you that don't. And just showing a sign of solidarity, a sign that this is a safe space, visibility saves lives. And I will say that over and over and over again.
And just to add to that, I think it also connects to like policy within the agency. Keeping in mind, when we think of family, sometimes we can think of like the stereotypical like, nuclear family, a wife, a husband, 2 kids. That's not always the case in queer communities. There's chosen family, and like having space for that to have some type of
Mhm.
medical coverage, some type of understanding when there's bereavement as well. That really speaks a lot to the community and can show that they're seen and they're understood.
And I'll also add, while there should be pride celebrated throughout the year, I think June gives everyone an opportunity to shine and to at least offer some visibility throughout the organization. So something as simple as a flag raising event, for example, during the month of June, I think can also be powerful. So leveraging June as Pride Month to at least provide some function or event to show that there is solidarity across the institution, I think could also be very helpful.
I love those ideas. Brian, I honestly hadn't heard of the looking at our policies to make sure that we acknowledge chosen families. So that's a good one to actually take back to Forge. All right, we have another question. Given the I've just got from HR, we actually do. I didn't know that. So we do acknowledge chosen families. Look at us. See, innovative, I tell you. Forge is innovative. Alrighty. Question. Given the recent ban on gender affirming care for minors in Supreme Court, one of many attacks on trans folks. How can we support trans folks after a devastating ruling like this? So the question is, given the recent ban on gender affirming care for minors in the Supreme Court, this is one of many attacks on trans folks. How can we support trans folks after a devastating ruling like this?
I think a big part of that is bringing it into the clinical space, like having opportunities to process just the emotional impact some of the institutional harm is having. And again, that comes through like creating a safer space and like having opportunities for exploration. Again, on our end as clinicians, staying informed of like what's happening and what's affecting some of the people that we're serving, and exploring opportunities where we can be active. Again, going to socio-political engagement on our end, advocating in our communities, doing what we can as well in the interim. Um, we'll do when possible, like things like gender affirming letters, maybe for um, it obviously isn't going to be surgery right now, unfortunately, but even like something like HRT or just exploring what other options there are and having that be a collaborative effort with the client.
I agree. And I think the other point to be made as well is that transitioning, in addition to medical transitioning, there are other ways that individuals will transition, whether that be socially, for example, or Brian, you were alluding to legally transitioning. And I think we need to facilitate and reinforce and support those other forms of transitioning as well, because they can be just as, if not sometimes more important for an individual as well. So I think we need to continue to support the transgender, gender diverse community on their journey, and really offer venues to enhance social support and mental health services as well along the way.
I agree with everything that was said wholeheartedly. And I also think too, this is where like going back to like some real basic stuff in terms of clinical work, right? Therapeutic work is, be strengths based, right? Let's, lift people up, when they're really feeling pushed down by the system, right? Like, can we, highlight the resilience that they've had so far? And, how do we build that even when there's barriers to care? And how do we really strengthen those internal resources that they might have so that we can help them continue to survive until hopefully there's some positive change.
Thank you, Kara. All right, everyone, we are almost at a wrap, and I want to make sure that I ask you all one last question, which is if you want to leave the audience with anything today, what do you want them to remember from this conversation? I'm going to start with Kara.
I think the one thing that I want everyone to remember is to stay involved and keep the conversation going. This hour is a good start, but as we've acknowledged, this is a drop in the bucket, and I can't believe that it's already been an hour, right? We could have these conversations for days, weeks, months, years on end, right? And we need to be having these conversations. So don't just end the Zoom call and leave it there and think that you've done, all of the work that you need to do in this area. Keep the conversations going and stay involved.
All right, Brian, what do you think? One thing you want the audience to be left with?
Um, One thing that I often try and highlight with clients and with other providers, the importance of like seeking out joy, like in moments of pain and suffering. Like we're thinking of, Juneteenth is tomorrow, that connection with the queer identity as well. The ways in which, Black communities, queer communities have survived generations of pain and suffering has been through seeking out those moments of joy, um, and other ways as well, like activism. But I want to just encourage folks to highlight that part as well with clients, not just the concerning parts of what the data suggests. There's hope, and we see that every day. So just a reminder.
Thank you, Brian. And Ralph.
So I'm actually going to close by using something a patient actually said to me once. And it was shortly after the election last year. And obviously, there was a lot of despair in the community. And a patient said to me, and this sticks to me, and I remind myself of this every day when I feel that perhaps we aren't going in the right direction. This particular patient said to me that social progress is not always linear. I always believed that social progress was inevitable, that we will continue on this trajectory towards social equality, social equity. Um, but obviously, things have happened over the past several months where many of us perhaps started to think otherwise. But this patient said to me that day, and again, it's so vivid in my mind, that social progress is not always linear. And I'd like to think of the current state of the world as sort of a zigzag right now. And what we're experiencing is part of that downward slope of that zigzag. But I remind myself that as long as we continue to work together, that we will continue to prosper, we will continue to succeed. We need to remember that these moments of resistance need to serve as a catalyst, if you will. I think we need to unite to defend hard-won gains that we've made in the past, and we need to emerge from this even stronger. And as long as we persistently advocate for justice, I think collectively we can ensure that that trajectory of social equity, that social justice for everyone, will continue to move in a positive direction.
So beautifully said, Ralph, and thank you all for your parting words. I love that the themes that you are leaving us with is continue this effort. Let's unite as a community, seek joy. Because there is joy in every piece of the zigzag, as Ralph indicated. If you look for it, there is joy. And you're right, change is not linear. Sometimes it goes up, down, sideways, but it is changing. And the fact that we're able to still have this conversation when there are things happening in the world that would suggest we shouldn't be having this conversation shows that no matter what's going on around us, we are continuing to unite for the right changes to occur. So that is the joy that I see and I feel in this conversation. One other thing is visibility saves lives. So throughout this conversation, we talked about just making sure that it is visible that to your clients and to individuals in the community that you are a safe space, that you are willing to learn, that you are an advocate. Having just a little symbol here and there. I don't know if anybody noticed my pride earrings I have on today, but if you just have symbols here and there, it makes a world of a difference. If you are in those spaces with the community and a part of the groups and the conversations, you are being visible to advocate as well. So I love when you said visibility saves lives because we have to be visible with our actions in order for people to know that we are in this with them. Thank you so much, everyone. Thank you, panelists, for this awesome conversation today. I hope people got something from this discussion, whether it's ways that you should be treating the population, advocating in the community, and or you're just leaving with a sense of joy like I am in my heart. Thank you for joining us, and I can't wait to see you all again. Appreciate it. Have a great rest of your day, everyone.